We humans are always keen to find new things. And in this little time of period, we have found many and we have invented many things. And some of them we can say space shuttles to go beyond the space and have to start the colonies in Mars that we have already made plans, making sophisticated small mobile phones, smart mobile phones. But even though we are having this wide range of technologies, still we all facing a global pandemic crisis. And with that, we all having a one question in our head. Why don't we still have a cure for COVID-19? Contestia and my dear friends, well, before I answer this question, let me take you on to the how the clinical process of a vaccine or a medicine is going to be processed on. So as you can see in these slides, so first of all, we have to do the basics research. So the basic research means that in here, we have to look into the, now in here, COVID-19 virus, we have to look into the COVID-19 virus and we have to study the virulence of it, the protein structure of it and everything. So then only we know how we can treat to this virus. So no, before to make a drug or a vaccine, we have to know to whom we are going to attack. So therefore, the basic research is mainly is depending on the virus. So for this, actually, we need to know the genome code of this virus and everything. We need to really look into to go on the process of this making a drug. Then let's say that we have already done the basic research now, and then we are going for if you are making a drug, we are going for the clinical trials. Now, in these clinical trials, actually, we have three phases: the phase one, phase two, and phase three. So, in the phase one, actually, we are looking for a safe dosage and trying to have a safe, trying to check the safety of the use of this drug. So, in the phase one, we are looking in how does the drug react on the body in us, and what does the our body does to the drug. So that's mean in another way the pharmacokinetics and pharmacodynamics. So these things we really need to focus on because before making a drug we need to know if we make a drug, how does that drug work on our body, what kind of effects will happen to our body, and whether our body able to accept this drug, and how this drug will be metabolite in our body, and how this drug will be distribute all our body and to the target organ or to the target area in our body. Then the phase two, again we are looking uh, into the safety dosages of this drug. So in here, in the drugs, there are always a limit of taking the dosages. You can't take higher dosages as well, and there's always actually a minimum rate of a dosage that we need to look into take a drug. So the in the phase two, we are mainly looking into the minimum dosage of the drug and the tolerant dosage of the drug. So in this rate, we are looking and make sure that the drug, the difference of this is with the toxicity will be not be will be gone over. Then after of this phase 1 and phase 2 and phase 3, all these phases have been successfully completed, then we are going for the regulatory approval. So then the human trials are finally is going to be given the approval to do the human trials. So we are trying in there, then starting the human trials by taking one human, voluntary human, and then a 10, then 100, and slowly we are increasing the numbers. So it's not going to be an easy process for this. So because the basic research even takes some time, and even the clinical phase to know the how does the drug really works on the body, and the what does the drug does to the body, it takes more time than we think of. It's not going to be months, it's maybe going to be years as well to properly understand. And even though if we properly understand the how does the drug is going to be acting on these each of these patients and in the body, well, each one of us are going to be unique. So therefore, as you can see in here, so if you take a group of people, so in here a patient's group, so sometimes if we give the same drug to these people, some of them will be getting the drug will be toxic, but it has the beneficial effects as well. And some, the drug is toxic and it doesn't have any beneficial also. And then the drug not toxic and it's not beneficial as well. And then the last one, drug is not toxic and it's beneficial. So as you can see, if you take a generalized drug, so within our genes 25 percentage only we can say it's properly works. So we can't say, we can't have a saying this is the proper cure for the COVID-19, because it might be work for me, but there's a chance that it will not be working for you as well. Then the other factor is the immunity. So if you're looking into the vaccination process, so the vaccines, it needs to be we think that why the vaccines not be going to be work on, and some have this misunderstanding that vaccine is a cure as well. Well, no, vaccine is not a cure. Vaccine, to get, if you have been vaccinated, still you need to have the immunity in yourself, because as you can see in this slide, vaccines means an active immunity process with the so active immunity means that you need to have in your body, you have to be actively have the immune system. So if you are, even though even though you get vaccinated, if you have an impaired immunity system, or if you are above 75 years, or if you are smaller than the 12 years, maybe there is a chance that your immunity system is not properly functioning. So therefore, even though you get vaccinated, that vaccines will be not able to do its function properly, because vaccines, this is how the vaccines work. The vaccines needs to be work. You have to first vaccinated, and then the antigens will be go into the body, and then these antigens will uh, stimulate the antibodies in our body. So if we don't have these proper strong antibodies, even though we have created the antibodies against the virus, when the actual virus comes, and if our antibodies are not being strong, still this virus can attack the antibody, and uh, it can destroy. So that's why sometimes now you can see that even though getting vaccinated, some people are dying, and some people are, even though getting positive in COVID-19 virus. And another factor, all of these things will, let's say that all of these are going to be work, but when all these things are when we have created a proper cure and a proper vaccine against this virus, but remember, COVID-19 virus having a genome of RNA. So what is RNA? RNA is a single-stranded nucleotide sequence. So not like DNA. DNA is a double-stranded nucleotide sequence. So as you can see in here, single-stranded nucleotide sequence can easily can be uh, mutated by having a substitution or addition or deletion. So therefore, as you can see, the proper vaccination method or even having a cure is impossible in a short time period, because no matter what is going to be happen, sometimes all these are going to be useless when the virus itself mutated and in the virus is being evolved. And that's why we are having these variant types of variants in the COVID-19 virus. It started with the alpha, now it's we are going for the delta, and even there's a delta plus. So more and more virus is going to getting mutated and evolved. So it's a very hard process, but I'm not saying it's impossible. However, with the sake of the humanity, we will be able to find out and crack this code of, and hope to find a cure in the near future. Thank you very much.